This is Jefferson Close-Up. I'm Carol Celine. My guest today is Dr. Dan Frisch. Welcome. Nice to have you here.
Thanks for having me.
Now, you played a lot of ice hockey growing up in Maryland, and your favorite childhood memory involves going to an ice hockey game. What was that?
Yeah, that actually really does bring back a fond memory. My mom, who's a midwife, one time delivered a baby for a couple who had seasons tickets to our local hockey team in Washington, the Capitals. And we sat in the front row of this professional hockey game. And as you can imagine, for an 8-year-old, it was a pretty exciting thing to do. It really got me on the path of liking the game and wanting to be like those guys.
Did you always want to be a doctor?
Believe it or not, I thought I wanted to be a research chemist when... The problem I found with research chemistry is that it was somewhat isolating. As intellectually interesting as the work was, there really was not much interaction with other people.
Your specialty in cardiology is electrophysiology. Could you describe what it is that you do?
Sure. So I've been trained as a cardiologist, like all of my other colleagues, but the subspecialty training, my focus is on the way the heart beats. For some people, it's too fast. For some people, it's too slow. And for other people, there's a vulnerability to one of those two problems happening even in apparently normal function. So the most common disorder of the heart rhythm in this country, and in fact around the world, is something called atrial fibrillation. And that condition, briefly, is a condition where the electrical function of the upper chambers of the heart start to act chaotically and erratically, leading to dysfunction of the lower chambers of the heart. For years and years, we treated the condition just with medicines, but in the last several years we have other options, minimally invasive, that have actually gotten us better results than medicines alone.
Now, what would you describe as your personal approach to dealing with patients?
When I see patients for the first time, the first thing I like to do is listen to what's bothering them. I know for myself, even before I've met someone, a lot of times I can figure out what their risk factors are for some of these other consequences of atrial fibrillation, for example. So my approach first is to figure out what's on their plate and then figure out what I need to put onto their plate.
Oh, nice analogy. Would you say this kind of approach to being with patients fits in well with your life motto?
I think so. I mean, I always feel like every day is an opportunity to learn. And an opportunity to be better in some way. But on the other hand, it's also nice to be able to do something with that knowledge, such as helping people or such as giving it back in any way that I can do that. And it does help.
So it sounds like you found the right career for yourself.
I'm very happy, both with the career and very happy being here at Jefferson.
Thank you for joining us today.
Thanks so much.